Yeah, I think we are on live. Yeah. So, okay. Yeah. Hi, எல்லாருக்கும் வணக்கம். So, it is going to be yet another lightning talk this week. So, this week we are going to talk about a topic which is related to nursing students. So, if you're studying nursing and if you want to explore what is the future, how your future is going to be, how you can shape your future. So, this is a right session. So, before we start, so I would like to thank Mrs. Minija Joseph, and Narayini Chandrasekar. Thank you so much for coming up and taking up this session. So before we actually start the session, I would like to call upon Dr. Ramakrishnan Uncle to talk about SEEEDS.
Oh, vanakkam. Good morning and good afternoon to everybody. We are so honored to have Sister Minija Joseph and Sister Narayini Chandrasekar from UK. Our nursing students are indeed very fortunate to have such elite, eminent guidance from people of this caliber. நீங்க எதுக்குமே கவலைப்பட வேண்டியதில்லை. You are going to be fulfilling the dreams of SEEEDS. So we started our whole enterprise for students to come out of poverty for themselves and their entire family through education. So for that reason, we picked the best of the best students like you. We started 4 years ago. We are grown to about 240 students plus this year, including this year's admission. We have 14 nursing students in our group. We are also having our allied science students joining us to explore and look at how nursing career is. And we are also going to take care of you guys in the future. Don't worry about it. So it is our pleasure and honor. We grown from small 2 students in 2016 to the current level, thanks to great volunteers like Sister Minija and Sister Narayini Chandrasekar. I don't want to take any more time from the students to get their and the input from the speakers. With big welcome to our guests. We are honored to have you, ma'am. And I know you will be there guiding our students whenever possible and wherever possible. Thank you so much.
Thank you. I think it's probably my time next.
Yeah, Sister Minnie, can I give a quick intro? Mohan,
yeah.
Are you?
Go ahead, Nivedita. Yeah, go ahead.
Mohan, do you want to complete on volunteers and donor section? And
that's fine. That's fine. You can start. Yeah, that's fine. Already we are delayed. Yeah.
All right. And first, I would like to thank Sister Minnie and Narayanaka for doing this for us. So, students எல்லாருக்கும் சொல்லணும்னா சிஸ்டர் மினி வந்து நர்சிங் மேனேஜரா இருக்காங்க இங்க கிளீவ்லாண்ட் கிளினிக் லண்டன்ல. பட் ஷி ஸ்பெண்ட்ஸ் a lot of time. இப்போ அங்க இருந்து இந்தியால இருந்து கஷ்டப்படுற யாரா இருந்தாலும் அவங்களுக்கு என்ன உதவி வேணும், இங்க கொண்டு வரணும் லண்டன்ல, அவங்க ஒர்க் ஆப்பர்ச்சுனிட்டி எல்லாத்த பத்தியும் அவங்க பாத்துக்குவாங்க. அண்ட் ஒரு ஸ்டூடெண்ட்டும் ஒரு வருஷத்துக்கு ஒருக்காவது ஒரு ஸ்டூடெண்ட் எப்படியாவது அங்க இருந்து எடுக்க பாப்பாங்க. அவங்க கேரளால இருந்து இந்தியால இருந்து எப்படியாவது ஒரு ஆளை கொண்டு வர பாப்பாங்க இங்க. சோ ஏன்னா உங்களுக்கு இதை தமிழ்ல சொல்றேன்னா, I want you to understand, அவங்க இவங்களை மெயினா கொண்டு வந்திருக்க ரீசன் வந்து உங்களுக்கு ஜாப் ஆப்பர்ச்சுனிட்டிஸ் வெளியில எப்படி எடுக்கலாம், நீங்க எப்படி உங்க லைஃப் இதை இன்னும் நல்லா இது பண்ணி கொள்ளலாம்ன்றதுக்காக தான் மெயினா அவங்களை கூட்டிட்டு வந்திருக்கு இன்னைக்கு. And Sister Minnie, I just want to let you know you've been a great pillar to us. Thank you so much for doing this for us. And அடுத்தது நாராயணியக்கா வந்து உங்கள மாதிரி தான். She's an inspiration to me. ஏன்னா அவ்வளோ ஒரு கஷ்டப்பட்டு இலங்கையில ஓர்ல நிறைய பிரச்சனை பட்டு வந்திருந்தாங்க. இங்க வந்து அதுக்கப்புறம் நர்சிங் படிச்சு லண்டன்ல இப்போ ஒரு நல்ல பொசிஷன்ல இருக்காங்க அவங்க. எனக்கு அவங்கள பத்தி முதல்ல எனக்கு இந்தியால இருந்து தெரியும். ஆனா அவங்கள எவ்வளவு நல்லா வேலையில செய்யறாங்கன்னு எனக்கு தெரியல. ஒரு நாள் அவங்க Facebook போஸ்ட் பாக்குறப்பதான் தெரிஞ்சிச்சு 100 பேருக்கு மேல அவங்களுக்கு இங்க இருக்கிற லோக்கல் பீப்புள் வந்து அவங்களுக்கு கமெண்ட் பண்ணியிருந்தாங்க. I was really impressed. அதான் I thought she must, அவங்க உங்களை மாதிரி ஒரு இதுல இருந்து அவ்வளவு நல்ல நிலைக்கு வந்திருக்காங்க. I don't think அவங்கள விட வேற ஒரு எக்ஸாம்பிள் உங்களுக்கு இருக்காது. நீங்க அவங்க பேசுறப்போ தெரிஞ்சுக்குவீங்க. Yeah. And thank you, Narayini Akka. Thanks a lot for coming today. Thank you. Thanks, Paul.
I think I'm going to start now. I will start from, I think I have to say good evening, good afternoon, and good morning, because we are from 3 different countries here. Before I start, I just want to say thank you for inviting me. It is, I don't think so. When I look at your vision, I can see you says educate, enrich, and empower. So educate means I have a responsibility to educate people. It doesn't matter who they are. So I think I'm just doing that. I'm not a special or anything. I'm just doing educating people. Enrich. Enrichment is not just collecting money or earning money. I think we need to enrich ourselves with the knowledge. That is what I consider as an enrichment. Of course, there is a money in the end of the line, but more about enrich ourselves with the knowledge to provide the high quality of patients. It's benefit our patients, our community, and our colleague nurses or other healthcare workers, and plus our organization. Wherever you work, it will benefit the organization also. Remember that. And empower. See, my job is to empower other nurses to bring their maybe their educational development, maybe their improve their knowledge, maybe empower them to speak up, to guide them to reach their higher standard. That's all I'm doing. It's nothing special. I'm just following your vision and mission, basically, in the SEEEDS. Yeah. So that's what I want to say before. And I'm going to talk about mainly 3 things today. First, we will talk about how can you get to UK? What is the requirement? Second, when you get here, what do you have to do it? And have you practiced this then? What kind of job roles are here for you? These are mainly my focus on topic. So first we can talk about, if you want to, are you anybody from Sri Lanka? Is all everybody from India?
There are few students from Sri Lanka here.
Okay, that's fine. It's good to know that there is no difference from Indian students or Sri Lankan students. It's a general standards across the international students. Okay, so I'm sure you might be a first year student or second year student or third year student or fourth year student, or you might be finished nursing. It doesn't really matter. Your focus is now to complete your nursing and be a good nurse. Complete your nursing means don't think I just need to get a pass mark, I'm a nurse. You should get an adequate knowledge what you're doing, and make sure you gain the best skills. Yeah, skills, not just injecting medicine or giving a dressing or not. I don't think so. That's the skills you need to develop to work in UK. If you want to work in UK, your skills you need is you should have good communication. Don't be shy. And you need to be very open communication. Sometimes, what will happen to us, we're very good in talking in the changing rooms or at hostel or a boarding school, wherever. We're afraid to talk at the workplace. Yeah, it's very important. You should have that open communication style. That will help you when you come over here to work. Okay, so very important leadership skill, communication skill, and very good in documentation. Sometimes I notice our Indian nurses, Sri Lankan nurses come over, they're very poor in documentations. You always document your patient care is very important. It's a legal papers. It's not like an international side here. When you come here in UK, it's more legal. Your documentation can go to court even for some kind of complaints there. So it's very important you follow these things. Yeah. So these are the main things you need to consider while you are learning nursing. Okay. So once you finish your nursing, if you want to work in UK, you need to have a registration from NMC. You need to know what is NMC. NMC is a nursing council here. I'm sure about you may have heard Indian Nursing Council or Sri Lankan Nursing Council or Kerala Nursing Council. I don't know if Sri Lanka got each state have a nursing council. I'm not quite sure about, but there is a nursing council in your own country also. But in UK, if you want to work, you need to be a nursing council registration. That is Nursing and Midwifery Council. So it's very important to get that registration. To get that registration is a long way to go. Okay, it's not easy. Just you can go and apply and just get next day. No, it can take up to 12 to 18 months. I'm very honest with you. To get nurses from abroad take 12 to 18 months. It's a long process. When I explain, you will understand. Okay. That's what in UK. Let's start with once you finish the nursing, you need to understand which area you're supposed to work to come to UK. There is certain areas very, I can say there's lots of scope of practice, particularly if you are a surgical adult nursing, don't do pediatrics. That's my advice, because pediatric nursing is very different in UK. You have to have a pediatric qualification. If you are an adult nursing or you worked in India as a pediatric nurse, you cannot work in UK as a pediatric nurse. So just try to avoid that pediatric side, concentrate on adult surgical ward or adult medical ward. It doesn't matter which wards, orthopedic or general surgery or colorectal or a cardiac surgery, it doesn't matter. Concentrate on adult medical ward or a surgical ward. Very good. Or you can go and work in operating theater. Very good. And you can work in ITU, you know. And you need to understand the ITU is a patient who ventilated patients are usually there. When you say in ICU in India, usually after the surgery patient moved to ICU. Okay, that is called ICU in India. I don't know about Sri Lanka, how they what they call for that. But in UK, when you say ICU, that also ventilated patients are there. Here, if you want a patient move from theater to next stage, is called PACU, post anesthetic care unit or recovery unit. That's the terminology we use here. So it's very important when you apply for the job or when you fill your application, where you're applying. You need to have good idea, otherwise it's misleading information here. So it's very important. If you work in a post-surgery area, you should write you applying for a PACU, post-anesthetic care unit, or recovery unit. Don't say you are in ICU. ICU, ITU means in UK, all the patients are ventilated there, you know. So it's very different. You need to know that. Please don't go and work in midwifery side, because we don't take a midwife from internationally. So all the midwives are trained here in UK. And then another area, I don't encourage you to go and work in A&E, in emergency department. We don't usually encourage people to come from internationally to work in A&E here, because it's very different culture here. You won't be surviving there for. You can do it once you get here, working a couple of years in wards or somewhere, you can apply job in A&E. Otherwise, it's very different game there. So you won't be adjusting here to work there. So you concentrate on either cardiac ward or adult medical ward or adult surgical ward, operating theater, ITU or ICU or recovery unit. This is a commonest area we select nurses. I think the 80% of nurses coming from internationally, they work on the ward setting, adult ward setting, not pediatrics. Okay, it's very important you concentrate on that area. So then we need to look at how can you get here? What is the requirement here from in India or Sri Lanka to UK? The first thing, minimum. I know there is a rule come out last year. Oh, if you're a newly qualified nurses, you can come over. That's just in the paper. No hospital in UK will take you less than 1 year experience. At least you should have 6 months experience when you apply for the job. By the time paperwork and everything finish, you will finish more than 1 year. That is fine. But no point in you applying, you just qualified. No point in you applying. So minimum, the NHS hospital aspect, you should have at least 6 to 1 year experience. Definitely when you reach here should be 1 year, but when you apply, it can be a 6 months. That's the criteria. So that is minimum 1 year experience. Then you need to pass OET or IELTS. You need to understand what is IELTS. That is Old English exam. So international English language testing. Okay, that is very old. Nobody is using that system now. Everybody going for OET. You need to understand why. OET is a bit expensive than IELTS, but the pass rate is 80 to 90.
Sister Minnie, can't hear you.
Sister Minija, I think there is some issue with your phone.
What about now?
Yeah, we can.
I think accidentally I just noticed it's muted, but not me muted. It's get muted. That's why.
Oh, okay, no problem. Yeah.
I don't know. It's accidentally muting. That's why. Okay. So I don't know how far you heard, but I'm trying to say to you, you have to do an English exam. It's keep on getting muted. I don't know why is that.
We can hear you. We can hear you, Sister Minnie.
Can you hear now?
Yeah.
We can hear
I
you.
don't know. Yeah, okay. Let me know if you can't hear. Yeah. So IELTS is a cheaper course. I agree with you, but I encourage you to go for an OET. IELTS is a very tough to pass. It's just like a master's English level in India. You know the English level in the literature in India. That is the expectation. But when you go to OET, what's the importance of that? They only ask the question nursing related because it's very easy to answer. So they may ask you, there is 4 different versions. You know that one is reading, writing, listening, and speaking. The speaking, they will all ask you, when you see a patient, how do you going to introduce? That's simple questions they will ask you. It will be easy for you to answer. So when you go to the normal English exam, they will ask you, tell us about your recent holidays. It's very difficult to say that, no? Particularly in our culture, we don't go for holidays abroad like Europeans. So it's hard to answer the question. I know his money is very important, but rather than you jump into the exam next week, prepare properly, take your exam bit late. You can save the money, you can pass within one exam. That's the most important thing. Yeah. So concentrate on OET. Let me explain the pass mark. If you do an IELTS, reading should be 7 score, writing should be 6.5, and listening should be 7, and speaking should be 7. That is a score for a IELTS. And if you fail for once you finish the exam, you can rewrite within 6 months and you can couple it together and make it that full score. That is fine. But if you do an OET, the score is not just like a 7.5. They will say that reading should be B, writing should be C or C plus, listening should be B, and speaking should be B. It's like a mark like 350, they say. That's the way. It doesn't matter whichever they mark, but this is a score you want. So that's the first stage, okay? First stage, you need to finish OET. Once you finish OET, don't worry. You just let me know your CV and let me know you finish. You send me a copy. Rest of the thing, I will take care of you to come over here. Yeah, don't worry. You don't need to pay any money to come over here. I have good connection with NHS hospital. I'm very happy to support lots of candidates coming from India and particularly in Kerala every month through me. So the most important, the goal is sitting with you. You have to pass the OET. Rest of them are easy. Okay, it's concentrate on OET and concentrating on OET English exam. Let me tell you something. You don't start talking English after your nursing. You should be starting now. Of course, you cannot go and speak to your parents every second English, but you should be speaking always English at your workplace or your college, at your changing room or your coffee room or wherever you see, only speak in English. You need to have that fluency and in English if you want to go through this exam. That you start from your first year nursing, not you've already wasted 4 years otherwise. 4 years plus 1 year in experience, that 5 years you had enough time to learn that. How do you achieve this English? I was very poor. Let me tell you, I studied from very poor Malayalam school. I couldn't even speak one word English at age of 22 after my nursing. I'm not joking. I used to run away from the phone when the people call me because I know that when I used to work in Madras, they cannot speak in Malayalam. Everybody speak English. I didn't know any word of English. I should be run away from the phone because I can't answer the phone. See, I wasted my time, but I don't want that things happening for you guys. You have a great opportunity. I didn't have any media that time. There was no phone. Nowadays, everybody have a phone. Why can't you listen to English news? Simple thing. Read English newspapers. There's lots of opportunity. There's lots of videos. Why do you need to go behind the Tamil? Tamil is good. I'm never against the Tamil, but that's your language you already know. You don't need to learn, but you want to learn something. You have a dream to go abroad and work. So then you need to work hard. So every day, listen, at least half an hour, you should take a decision today. I'm going to watch news, English news. I'm going to read at least for 10 minutes. Start with the 10 minutes. 10 minutes out of 24 hours, I'm asking 10 minutes. Read a newspaper and speak out of 24 hours. At least speak 2 hours. to a colleague in English. That's enough to improve your English standards in 4 years. Yeah, it's very important. You should do that. Okay, that's all I want to talk about English. So that's 1 year experience. We spoke about that. Then OET and IELTS exam. So after that, during this time, you can send an application to, after this, you can send an application to NMC. Don't worry about how to apply for NMC or anything. You just want to let me know I completed my OET or IELTS. Okay, I will guide you that. Forget about that. You don't need to worry. So next thing, let you know after that what you have to do it. After that, you have to do a CBT. Okay, computer-based test. CBT have 2 parts. It has 2 parts. The first part is a computer-based test that usually happens in India. You can do it in India. Yeah, 2 parts. The first part you can do it in India or Sri Lanka. It's a computer-based knowledge test. Okay, so I don't know, you may have heard about NCLEX in US. Same like it's a computer-based questions. Let me tell you what is this computer-based question. These questions are checking your knowledge. I don't think so there is any issue because you literally finish your nursing course. You should be very fresh in your brain, not like somebody study finish and work for 10 years. They may struggle because lots of clinical knowledgeable questions coming in. Usually there should be 120 questions. Yeah. Out of that 120 questions, 20 questions, you should get 99% of critical question mark. There's a critical question and standard question. Critical question, you should get 90% of mark. Overall, it should be a 60, I think it's 66% mark you should pass. That's fine. Okay. Then you CBT, the first part you passed. Second part, you can only do it in UK. That is called OSCE. Yeah, OSCE means Objective Structure Clinical Examination. That's done in only in UK. There is only 3 centers in UK to do that. It's not every hospital, every university doesn't do. So only 3 centers currently do OSCE text. This is just a practical test. They're going to be like a 5 or 6, 7, like maybe an injection they can ask. They may ask you to write a referral letter. They may ask you to write a cardiac CPR to do it, or you can write a care plan. This kind of question they will ask. Okay, that's just a practical exam. Don't worry about that. Once you reach in UK, they will train you how to go for this one. You should have training initially, like 12 weeks intense training, how to attend this one. What do you answer? How do you answer? You need to learn from here. No point you learning from there. So don't worry about that also. Okay, your concentration is always, I said, priority is your OET. Okay, but just to let you guys know, there is CBT has 2 parts. One is a computer-based knowledge test. Second is an OSCE, is a practical test. That's only can done in UK. That's all about OSCE. Once you're done, you finish all your things. You will get registration that evening after the OSCE finishing day. You are registered nurse. Okay. Another thing you need to know, once you finish your CBT, you coming over to UK. Once you come here, UK, your grade is like a band 4. You start with the band 4. Okay. Band 4 means you are at some hospital, they say international educated nurses. Some people say overseas nurses. Some people say adaptation nurses. Doesn't matter. Whatever the names they call, you are an international educated nurses. That means you educated in the other country and you come over here and you got band 4. Okay, that is a minimum. When you work as a band 4, you are paid salary. That is only started after 2003. I came 2000. But I didn't get any salary for first 3 months when I get the registration. I had to pay my own accommodation. I had to pay my own travel. I had to, my own food. Everything was my own. There was no salary. Now everybody paid a salary. It's a basic salary. Band 4 is a quite good salary. You can survive in UK. Okay. So once you finish the registration, you will be promoted as a band 5. Yeah, let me talk about the grading system in UK. You start as a band 4, then you start as a band 5. The band 5 means you are a registered junior nurse. Yeah, you can go up to 8D. Let me tell you, band 5, band 6, band 7, band 8. 8 have 4 different versions, 8B, 8C, 8D. Currently, I'm working as an 8C. In 20 years' time, you see how much I reached? I'm in 8C level. So I started as a band 4 with no salary. Then I started as like band 5 in 2000 end. Then I worked as a band 5 3 years and I become band 6. Then I worked there for 3 years. Then I become band 7 in 2007. Then I will become 8A in 2012. Then from there, I moved 8B and now I become 8C level. See, there is a lots of opportunity if you are determined, if you are willing to learn, if you are taking your own commitment, and nobody going to force you for anything here. It's your responsibility, and it was my responsibility. I have determination, I have commitment, I have passion to do things. Okay, then only you can progress in our career. Next, I want to talk about a little bit about the NMC. Okay, I said the NMC is our Nursing and Midwifery Council. Currently, we got around 700,000 nurses on our registration list. They know how many registered nurses in the country. We got around 26,000 nurses vacancy in the country. 26,000. Imagine that number. You can be one of them. That's all I can say to you. You can be one of them. Why can't? There is an opportunity. This is only started this opportunity in 1999. Before that, they won't allow any international nurses to reach in this country. And the nurses are the only one allowed to come this country and just get registration within 3 months. Ask the doctors how long they need to get a training to become a consultant here. Minimum 6 to 7. Nurses, just the 3 months. Yeah. And it's a very good paid salary. Don't think nurses are not paid like doctors here. I don't believe. Okay, nurses are, the trainee doctors will earn exactly like nurses' salary in this country also. Not like you see in our own country like India and Sri Lanka, that's huge variation. No, it's not like that. Okay, there is very closeness between doctors and nurses' salaries here. Probably people are not aware about. I'm quite aware about these things because I worked in that level. I know the doctors and consultants' salary in this country very well. So don't be afraid of all that things. So the NMC, we got around 26,000 nurses vacancy currently. So we have something very special in our NMC here. I don't know, probably you won't hear there when you study nursing in India, Sri Lanka. I never heard when I was in India or anything. But here we got very good things I want to talk to you about. The special things is a NMC code. NMC code means it's just like our little Bible. I don't know what you say. Your most important book for you to practice your clinical practices, safe things. So what we use it for that, basically, you always prioritize patient. Whatever you do it doesn't matter whether you do it in the hospital or community, make sure you always prioritize your patients and people, okay? Then practice effectively. You have to practice effectively. It's very important. You should be fit for purpose. Yeah, it's very important. No point you coming with the old skills and old knowledge, because nursing is like a fluid. Every second is changing. The evidence-based practice comes, new research comes. We need to update regularly. It's very important. Then always preserve safety. Very important. Whatever we do should be safe. Safe for our patient, safe for our colleagues, and safe for our community, and safe for our organization. Whatever we do it, always make sure we are safe. You know what? You should practice all these things when you are a student. All what I said now, always prioritize people, practice effectively, preserve safety, and promote professionalism and trust. We are professionals, you know. We don't behave like kids. We always mature. We can have conflicts in between our workplace, but we have openness. We can make sure we talk each other and finish, rather than, you know, always trust and keep that professionalism, share that professionalism. And I know in India and Sri Lanka, probably it's difficult to people to outside, I'm a nurse. They're ashamed. Why? It's the most beautiful profession, I think. I'm sure about some doctors are around, but sometimes they think their job is much better than us, but I don't believe in that. I think the nurses...
Sister Minija, I have no doubt about it. I think nurse's job is the hardest of all out there. It's the hardest job. And I think you need a lot of passion to do that. I've always mentioned to the other nurses.
Yeah, you need lots of passion and commitment, but there is a beauty, you know, that satisfaction. That's what it's all about. We always with our patient, you know, from their birth to their death, who will be there? We are the only people stay along with them. Yeah, it's very important. Whatever we do, we chose nurses not because we want to make money. Okay, money is the end story. Our job to provide the best quality of patient care, best care, we should provide to anybody. It doesn't matter. It can be your brother or sister or neighbor. Doesn't matter they're coming from which country or what color or what religion. It doesn't matter. We treat everyone equally. That's one thing we all need to learn. And I don't differentiate anyone. It doesn't matter which country or what color how they speak better, or it doesn't matter. Everyone is human beings. Remember that. Everybody's life is important. So that's the thing. So that's the thing about that 4 things. If you can just try to learn that from practice from your current student period itself, then I want to ask you one more things to do. How to achieve this OET? That's the most important thing, to achieve an OET, occupational English test. So I need to say for a few things to how to achieve that. First thing, start now, not after nursing. Start now, and be realistic about yourself and be realistic with yourself. I can say that way. Okay, be realistic. You don't need to show anyone, you can do this and that. Be honest. That's what mainly you need to. And know your weaknesses. You might be not good in speaking English, no, maybe not good in writing. Be honest and find that weakness and correct it. You don't need to show it to anyone. This is not to get appreciation from anyone. This is for yourself. So be honest and know your weakness. Understand the assessment criteria. This is what I said. There is lots of assessment criteria. There's lots of YouTube videos about how to do an OET. There's lots of papers online. You don't need to buy. You don't need to depend on anyone. Just when you get a free time, just Google it and start learning now itself. That's very important. Then improve your skills. Very important. When you speak in front of the people, you need to show that, just talking English is not just your skills. Your body language is very important. Your facial gestures is very important. Your smiling, your personality, your authenticity, your passion, your commitment. Sometimes you will come talk from your eyes. They need to see that when you speak English. It's very important in polishing your skills. When you speak in front of this interview, this exam panel, you have to go and speak in front of them. So you need to learn that skills. I know lots of our cultural barriers are there. We are very shy. We are not allowed to talk loud. That's all old fashioned. Okay. Now you all need to be open ourselves. We are the future society. So you need to have that thing. That's old fashioned. I know when I learned, I'm not allowed to go out of house after 5 o'clock. Nobody allowed to talk, make loud, particularly girls. I've all been through that. That is a very, very old fashioned. Now the world is changing. People need like you. Yeah. So start doing that. Then apply only when you're ready. I said, no, don't just go and waste money. Oh, I just want to do an OET. It's costly. It's very expensive. So don't go and do, I don't know what exactly the price, but I'm sure if I think about last year, IELTS was around 14,000, OET was around 30,000. So it might be reduced now because he's keep on reducing the money to attract lots of nurses to join these courses. Okay. So only you go and do the job exam when you are ready. Okay. You don't want to please anyone. You need to understand money is losing from you. So don't want to, I'm ready. Don't do that. Even though you've taken the test after 6 months, if you can write first time, that's earn more better than you wasting writing 3 times. Think about 3 into 30,000 rupees. It's a huge amount. Yeah. So it's very important you do it. I'm sure about, we will be able to, if you're a good candidate, I know if I get a feedback, she's ready to your exam, you can go and test your exam skills. And if you get a full, you say that, you are good in writing exam, you're ready for exam. I'm very happy to sponsor a few people. I'm not that rich, you know that, but I'm very happy to help you, if you have money issue to write an exam, but I need to have a guarantee. Very well. You worked hard to write this exam, not just for namesake, somebody is giving money free. It shouldn't be that attitude. It should be worth it. Okay. That's very important for that. I don't know anything else I have to talk about. I can talk a little bit, one more thing about the healthcare system here also. We have 2 kinds of healthcare system like in India and Sri Lanka. We have a national health care system. That is what National Health Service is called NHS. And then we got private hospitals. Yeah, if you look at in India and Sri Lanka, we have more private hospitals and less National Health Service hospital. Here is opposite way. Here is more government hospitals. Yeah, government hospital is called National Health Service. We have more National Health Service hospitals here and less private hospitals here. Okay, that is another 2 different system here. I don't know anything else. Anybody want to ask? If you have any queries, any questions, ask. I can answer. That's probably the better.
Just a minute. There's a question here. Can allied health science technicians also write OET exam? Do you
Yes.
happen? Yeah.
Yes. The issue you need to understand. Usually they won't. I haven't seen much recruitment from allied health workers from outside India to here.
Okay.
Because nursing is guaranteed because their name is in our short occupational list. That is why.
Okay, people doing dialysis or physician assistants and those kind of courses, do they have any?
Not really, because they don't accept the physician assistant course in India over here. It's not very highly promoted at present. I know US is there, but not in UK that much. Because recently in my current job, we're going to appoint quite few physician assistants, but there was lots of rejection from different area because they don't have a particular registration body. Some people say these people should sit with the GMC. Some people say it's the HCPC. There is not very clarity here. There is slowly coming up, probably in next 5 to 10 years, we can see some kind of difference. Yeah. Dialysis technician is not very common here. We can get a dialysis nurse from India, but not a technician.
All right.
It's very tough to get. I think recently they started to select some kind of paramedics here.
Okay.
Just I think in Bristol or Bristol in my memory, they're selecting some paramedics, but we don't have that paramedics in India, but they're taking people from like background of physiotherapy, all this allied practice, taking us as a paramedics. They're coming over here and they will give us special training because we have very short of paramedics now. They just literally started. I don't know the first batch arrived or not. Hopefully they will arrive next year. I think there was a recruitment this year in India, Kerala particularly.
Okay.
Sir, I'd like to add this on behalf of the SEEEDS board. We will work with you, and once you're satisfied, we will help them take the exams for those we think are ready to take it.
Yeah.
So we will assist them with the exam. If you help us pick them, say, okay, these many students are ready to take it, we will make sure we pay for it.
Bringing nurses from India is not at all a problem.
No, I was talking about the exam fees.
Okay.
Yeah.
So we will support the students to take it.
Okay.
If you give us an assessment and tell us these students are ready to take the exam.
You know, the issue is I won't be able to do that assessment. There is an assessors in India to do this exam. They need to go there for an assessment. Yeah.
Okay.
Yeah, there is an assessors in every corner of the country. Yeah.
Okay.
Every town they're doing an IELTS training centers and OET training centers.
Okay.
They just need to go an assessment. Assessment is not a big expensive thing or anything.
Okay.
Just go an assessment, then they will say the assessors, you are ready for the exam, or you have this weakness, you need to correct this one. You know, they will assess. They only then allow them to go and sit the exam.
Okay.
And don't allow any students to just allow them to go and sit as long as they finish this assessment. Only allow them, otherwise wasting money.
Okay. Sounds good.
Uncle, actually, just for your information, Uncle, there is something called Amazon Academy that's coming up. So they are offering a lot of sample tests on different exams, like INCAT or like different things. So probably I think there should be some kind of assessment tool which they are coming up with for these exams too.
Okay.
So what I can do it, I know quite few my friends doing an OET training, nurses. Yeah, English training. So I can probably connect with you, this team. The people are ready to do, when they finish the nursing, I can connect with you like a group team. Then we can have webinar and training. Please let me know if you have people like that. And I can connect some nurses who are already teaching the OET also.
Okay, definitely.
Already they are here. I can ask them to do for a few sessions with you, the students, to help them to do their OET training.
Sounds good.
Yeah, that would be good. Sister Minnie. And students, if you have any questions, you could ask Sister Minnie.
Unfortunately, I can't see you. I can recognize some of your names from India, Tani.
Sahaya Mary, Deepa, Ezekiamal.
I remember her name, and Saumya. Yeah,
Sister
but
Minnie, I have a question. Can I ask?
Yeah, of course.
Yeah. Yeah. Okay. So it's basically a two-part question. First part is there any minimum experience level they should have before they think of going to abroad, like specifically like UK you have been telling? That is, what is minimum experience and what is the ideal experience you think is good?
Minimum experience, I said 1 year. Ideal experience is 1 year.
Okay. Okay.
But you can start preparing when you are 6 months, because 6 months will take time for you to do CBT and all this. You know what I mean? You don't need to wait for 1 year finish and start, applying for that. When you reach 6 months, you can start, doing your CBT.
Okay. Okay. And then that 1 year experience, it could be from any hospital or any health provider in India.
Yes.
Okay.
Any hospital is fine as long as an approved hospital. Don't bring with your fake certificate. Yeah, it's very important. Lots of people doesn't work, then they will come with, if you paid 100 rupees to doctors and they give a fake certificate, they will do the fraud check here. Most of the applications, if they can do fraud check within second. There is a fraud office. Every NHS hospital have a fraud section. If you have query within 2 hours, they will bring all the informations where you worked exactly with all the details. So very careful. Don't bring any fraud details. Whatever you do is honest.
There's a question, is there any books available for OET exam?
You don't need books. There is thousands of video on the Google. Just Google it. Don't waste money to buy books and things. All free. Everybody have a phone and the internet.
Okay.
There's no book. There's lots of videos. You need to listen to videos rather than reading books.
Okay.
There's thousands of videos are there. Just Google OET English, exam, writing or reading. There's lots of materials.
Okay, good. Is there any other questions?
Why students are so quiet? Yeah, I know. I forgot Tamil, unfortunately. Yeah, but I don't want you speaking to me in Tamil. I want you to learn English. Okay.
Any one of you have any more questions?
You should ask question. You should have courage. Yeah, this is an empowerment. Ask one question each of you. Otherwise, I'm not allowing you to leave. Yeah, it's true. Why they're scared? This is an opportunity to speak one line English at least.
Sister Minnie, you pick them. You call them, Sister Minnie. Call them.
Armugam.
You know Armugam, sir. Do you remember? He was there. Yeah. He was the biology teacher.
I remember that name very well. Oh my God, they're all quiet. Are you scared of me?
Trishana,
I don't bite anyone. Don't worry.
Trishana, Naveen, Deepa, Kumada.
Hello. Are you all there? I know it's maybe 9 o'clock. It's not sleeping time.
Yeah. Mohan, maybe we will stop the stream and then students can ask. Is there
I think there is one more speaker, Prasadana.
Oh, is it? Okay.
Yeah.
Okay, sorry. Okay.
Sister Minnie, maybe then we'll let Narayini speak and then, we could ask the question session at the end.
Fine.
Okay.
Thank you very much. I don't personally know Narayini. Nice meeting you. Hopefully we'll have connected through the Facebook or somewhere.
Yeah, thank you so much. Thanks to Niveda, Ramakrishnan uncle, Prashad, Mohan, and Sister Minnie. Nice to talk to you, all of you. I will talk in Tamil. எல்லாருக்கும் நன்றி. நல்ல இது செய்துட்டு இருக்கிறீங்க. உண்மையில பெரிய ஒரு விஷயம் நிவேதா, as I always tell you. நான் இதுல நான் டிஸ்ட்ரிக்ட் நர்ஸா ஒர்க் பண்றது கம்யூனிட்டிக்குள்ள. ஸோ நான் எந்த எக்ஸ்பீரியன்ஸை கொஞ்சம் ஷேர் பண்ணுவோம்னு சொல்லித்தான் நான் நினைக்கிறேன். எதுவும் கொஸ்டின்ஸ் இருந்தா நீங்க கேட்கலாம், பிரச்சனை இல்லை. நான் வந்தது 2002 நான் வரைக்க இந்த கண்ட்ரிக்கு எனக்கு இங்கிலீஷ் துப்புரவா தெரியாது. நான் வந்து அதுக்கு பிறகுதான் நான் படிச்சேன். நான் இங்கிலீஷ் கோர்ஸ் செய்து நர்சிங் கோர்ஸ் செய்து நான் 3 இயர்ஸ் கோர்ஸ் செய்து நாங்க. அதுக்கு பிறகு கம்யூனிட்டிக்குள்ள வேலை செய்து நாங்க. அப்ப நாங்கள் உங்களுக்கு மாதிரியே இங்கேயும் நாங்கள் படிக்கல ஹாஸ்பிட்டலுக்கு நாங்கள் எக்ஸ்பீரியன்ஸுக்கு போவோம், பிளேஸ்மெண்ட்ஸுக்கு போய்கொண்டிருப்போம். கம்யூனிட்டி ஹாஸ்பிட்டல். ஸோ எங்களுக்கு எதுக்கு போகலாம்னு நினைச்சு எங்களை விருப்பமான இடத்துக்கு நாங்க போகலாம். நிறைய ஆப்பர்ச்சுனிட்டிஸ் இங்க இருக்குது. சரியான கம்ஃபர்டபுளா ஒர்க் பண்ணலாம். உண்மையில நான் சொன்னா இப்ப 3 இயர்ஸ் கோர்ஸ் நான் முடிச்சுட்டு நான் கம்யூனிட்டிக்கு ஒர்க் பண்ணா எனக்கு அதை பண்ணதுன்னு சொல்லிட்டு நாங்க நைட் ஷிஃப்ட் செய்ய வேண்டிய தேவை இல்லைன்னு நான் கம்யூனிட்டிக்குள்ள போனேன். நான் ஹாஸ்பிட்டல்ல செய்யக்குள்ள நீங்க நைட் ஷிஃப்ட் செய்யலாம், டே ஷிஃப்ட் செய்யலாம், எது சூட் பண்ணதோ அதுக்கேற்ற மாதிரி எங்களை கரியரை நாங்க சூஸ் பண்ணி கொண்டு போய் கொண்டிருக்கலாம். அதுக்கு பிறகு நான் கம்யூனிட்டியில ஒர்க் செய்த ஃபியூ ஹவர்ஸ்ல பேருந்து அதுக்கு பிறகு மினி சொன்ன மாதிரி தான் பேண்ட் 5 தொடங்கி பேண்ட் 6 அப்போ இப்ப பேண்ட் 7 ஒர்க் பண்ணி கொண்டிருக்கிறேன். ஸோ ஓல் எங்களுக்கு தேவைப்படுறது எல்லாம் கரேஜ், பேஷன், ஹார்ட் ஒர்க்கிங், ஆனஸ்ட், அவ்வளவுதான். இங்க ஆப்பர்ச்சுனிட்டி எல்லாருக்குமே அவைலபிள், எல்லாரும் ஈக்குவலா தான் ட்ரீட் பண்ணுவீனா. சோ நாங்க டிஸ்ட்ரிக்ட் நர்சஸ் நாங்க என்ன செய்யறோம்னு சொல்லிச்சுன்னா வீடுகளுக்கு போவோம். வயசு போன ஆட்கள் வீடுகளுக்கு போய் அவ வந்து ஹாஸ்பிட்டலுக்கு போக இயலாது, ஜிபி சர்ஜரிக்கு போக இயலாது, அவ வீட்லயே இருக்க வேண்டிய ஆட்கள் அவைக்கு போய் சர்வ் பண்றதுதான் எங்களோட வேலை. ஊசி போடுறதோ இல்லாட்டி ஐவி ஆன்டிபயோட்டிக் கொடுக்கறதோ இல்லாட்டி பலேட்டிவா அவ இந்த கடைசி நாள்கள்ல அவைய கம்ஃபர்டபுளா ஃபேமிலியோட வச்சிருக்கிறேன் நிறைய எல்லா கேரையுமே இப்ப கம்யூனிட்டிகளையும் கொண்டு வந்துட்டினா. அதாலதான் நாங்கள் அதுகளை நாங்க கொடுத்து கொண்டிருக்கிறோம். ஆனா ஏதாவது ஐடென்டிஃபை பண்ணினோம்னா பேஷண்ட்ஸ் வந்து ரிஸ்க்ல இருக்கணும், இன்ஃபெக்ஷன் ஏதாவது ஒரு பிரச்சனை என்ன சொல்லி சொன்னா நாங்கள் ஜிபியை கால் பண்ணுவோம், இல்லாட்டி ஆம்புலன்ஸுக்கு கால் பண்ணி அவன் ஹாஸ்பிட்டலுக்கு அனுப்புவோம். இப்ப அவ சொன்ன மாதிரி தான் என்எம்சி புக் தான் எங்களுக்கு இம்பார்ட்டன்ட். ஸோ நான் ஸ்ரீலங்கால இருந்துட்டு நிவேதா சொன்ன மாதிரியே எல்லா பிரச்சனைகளும் இருந்துட்டு இந்தியாவில வந்து 2 இயர்ஸ் இருந்தேன். நாங்க இந்தியாவில இருந்துட்டு நான் இந்த வரைக்குல நான் நர்சிங் செய்வேன் நினைக்கல. ஆனா நர்சிங் வந்து சரியான ஒரு சாட்டிஸ்ஃபேக்ஷன் ஜாப் எனக்கு. I really enjoy my nursing all through last 10 years I am working as a nurse. So அதுல கூட சாட்டிஸ்ஃபேக்ஷன் என்னன்னு சொல்லிட்டீங்கன்னா நீங்க போறீங்க பேஷண்ட்ஸுக்கு உங்களோட குட் குவாலிட்டி ஆஃப் கேரை கொடுக்குறீங்க, உங்களோட டைமை கொடுக்குறீங்க, யூ மேக் சேஞ்சஸ் இன் தியர் லைஃப். இங்கிலீஷ் அடிக்கடி வருது, சாரி. ஸோ நீங்க உங்களை இதை நீங்க செய்து கொண்டிருக்க உங்களோட டிசிஷன் வந்து சரியா இருக்கும் பட்சத்துல நீங்கள் அவன் லைஃப்ல எதுவும் ஒரு ரிஸ்க் வராம அவைய நீங்கள் காப்பாத்துறீங்க. அது வந்து உங்களை அந்த டே நீங்க சந்தோஷமா ஃபீல் பண்ணுவீங்க. உண்மையில ஒவ்வொரு செய்ய கட்டாயம் சேலஞ்சஸ் வந்து கொண்டுதான் இருக்கும், இல்லைன்னு இல்லை. ஆனா உங்களுக்கு உங்களோட டீம் இருக்கும் எப்பவுமே சப்போர்ட் பண்றதுக்கு. இந்த நாட்டுல நான் படிச்சது வந்து நீங்கள் எந்த இடத்துல இருந்து வாரீங்க, என்ன மொழி கதைக்கிறீங்க, உங்களோட கலர் என்ன, எதுவுமே பார்க்க மாட்டோம். நீங்க ஹார்ட் ஒர்க்கர், உண்மையா கதைக்கிறீங்க, சரியானதை செய்யறீங்கன்னு சொல்லி சொன்னா நீங்கள் அவ்வளவுதான் உங்களுக்கு தேவை. அவன் உங்களை சப்போர்ட் பண்ணி கொண்டு போயினா அடுத்தடுத்த இடத்துக்கு போறதுக்கு. என்ன சொல்ல நினைச்சேன், மறந்து போன நிமிஷம். இப்ப நாங்க டிஸ்ட்ரிக்ட் நர்சிங் இப்ப நர்சஸ் சொல்லிக்க அவ சொன்ன மாதிரி ஹாஸ்பிட்டல்ல நிறைய சர்ஜிக்கலோ இல்லாட்டி மெடிக்கல் வார்டோ போஸ்டோ போர்டோ எல்லா வார்டுகளையும் இருக்கு. அதே மாதிரி கம்யூனிட்டிக்குள்ள இப்ப நாங்க ஸ்டார்ட் பண்ணி பேண்ட் 5 கம்யூனிட்டி நர்ஸ் ஸ்டார்ட் பண்ணி அதுக்கு பிறகு நாங்கள் ஒரு டிகிரியை செய்து நாங்க டிஸ்ட்ரிக்ட் நர்ஸா வரோம். அதுக்கு பிறகு போய் டிஸ்ட்ரிக்ட் நர்ஸ் டீம் மேனேஜரா நான் வரேன். இனி அடுத்தது வந்து நான் ஒரு ஸ்பெஷலிஸ்டா செய்யலாம். ஸ்பெஷலிஸ்டா போகல இப்ப முன்கேரண்டா முண்டுகள் இதுல நாங்கள் ஸ்பெஷலிஸ்டா வரலாம் டிவிஎன் என்று சொல்லிட்டு. இல்லாட்டி டயபெட்டிஸ்ங்கிற டயபெட்டிஸ் வந்து பெரிய ஒரு இஷ்யூவா இருக்குது. அப்ப டயபெட்டிஸ் ஸ்பெஷலிஸ்ட் நர்ஸ்டா வரலாம். அதுல ஒரு கோர்ஸ் செய்தா ஈவன் இப்ப கோர்ஸ் செய்துதான் போகணும் இல்ல, நாங்கள் அப்ளை பண்ணி எங்கிற பேஷன் அவ பார்த்துக்கணும்னா அவ எடுத்துட்டு அவ எங்களை படிப்பிச்சு கொண்டு போய் கொண்டிருக்கணும். மற்றது எந்த ஒரு இடத்துலயுமே உங்களுக்கு கம்ஃபர்டபுள் இல்லாத செய்ய சொல்லி புஷ் பண்ணவே மாட்டினேன். சொன்ன உங்களோட காம்பிடன்சியை பார்த்துதான் நாங்க விடுவோம். இப்ப நான் சொன்னேன்னு சொல்லிச்சேன்னா எனக்கு ஒரு விஷயம் இது தெரியாது, அப்படி செய்ய தெரியாதுன்னு சொல்றதுக்கு ஒரு நாளும் வெக்கப்படக்கூடாது. உங்களுக்கு தெரியலன்னா சொன்னா அவ சொல்லுவேன்னா ஓகே நீங்க தெரியாத செய்ய வேண்டாம். அவன் சொன்ன மாதிரி என்எம்சி சொல்றது உங்களுக்கு தெரியாத நீங்க செய்யாதீங்க சொன்னீங்கன்னு சொல்லி சொன்னா உங்க ட்ரைனிங்குக்கு அனுப்புவினா சேர்ந்து என்ன செய்வினா உங்களை ட்ரைனிங் முடிய உங்களை இன்னொரு தெரிஞ்ச நர்ஸோட அனுப்பி கொண்டே இருப்பினா உங்களுக்கு நீங்க கம்ஃபர்டபுளா ஃபீல் பண்ண மாட்டோம். முதல் நீங்க நர்ஸோட போய் பாப்பீங்களா அதை எப்படி நீங்க செய்யறீங்கன்னு. அதுக்கு பிறகு நர்ஸ் வந்து நீங்க செய்யறத அவ அப்சர்வ் பண்ணி கொண்டிருப்பா. அதுக்கு பிறகு அந்த நர்ஸுக்கும் கம்ஃபர்டபுள், உங்களுக்கும் கம்ஃபர்டபுள் தான் உங்களை தனியா செய்ய விடுவினா. சோ எதுவுமே பயப்படுறதுக்கு தேவையே இல்லை. நீங்கள் அங்க நீங்க செய்ய வேண்டியது எல்லாம் வடிவா படியுங்க, கான்சென்ட்ரேட் பண்ணி படியுங்க, இங்கிலீஷா படியுங்க. அவன் சொன்ன மாதிரி இங்கிலீஷ் இப்ப இன்டர்வியூ அன்னைக்கோ நீங்க இங்க வரைக்கும் இங்கிலீஷ் தேவைப்படும். ஆனா அதுக்காக அது உங்களை கோல் பேக் பண்ண விடாதீங்க. அதுக்கு அது ஒரு விதத்திலையும் நீங்கள் ஐயோ எனக்கு இங்கிலீஷ் தெரியாதே நான் செய்யலாதுன்னு சொல்லி யோசிக்காதீங்க. கரேஜ் பண்ணி உங்களோட வாட்டுக்கு செய்து கொண்டு வரைக்கல உங்களோட வாட்டுக்கு இப்ப இந்த அடுத்தடுத்ததுக்கு நீங்க வருவீங்க கட்டாயம். ஹாஸ்பிட்டல்ல நிறைய மலையாள நர்சஸ் இருக்கணும், சரியான நல்லா செய்து கொண்டிருக்கணும். சரியான கட்டிக்காரர், ஹார்ட் ஒர்க்கர்ஸ். மற்றது காசு வாய்ஸும் நல்லா பே பண்ணி கொண்டிருக்கணும், தாராளமா காணும். நீங்களும் இங்க ஸ்பெண்ட் பண்ணி உங்களோட ஃபேமிலிக்கு நீங்கள் அங்க அனுப்பலாம். நீங்க என்னத்துல ஸ்பெண்ட் பண்றீங்களா பொறுத்ததுதான் நீங்க அனுப்பலாம். மற்றது எக்ஸ்ட்ரா ஷிஃப்ட்கள் நீங்க செய்து கொண்டே இருக்கலாம். 5 நாள் வேலைன்னு சொல்லி சொன்னா அங்கே 2 நாள் இருக்கு, வேணும்னா செய்யலாம். ஹாஸ்பிட்டல்ல அநேகமா கிழமையில 3 நாள் லாங் டே வரும். உங்களுக்கு மிச்ச 4 நாள் இன்னொரு 2 நாள் செய்தீங்கன்னா எக்ஸ்ட்ரா காசு வரும் உங்களுக்கு. அப்ப அதை வச்சுக்கணும் நீங்க அடுத்த விஷயத்த பிளான் பண்ணலாம். இப்ப நான் உண்மையில இங்க வந்து ஒன்றும் இல்லாமத்தான் நாங்கள் வந்து இன்றைக்கு நான் படிச்சோ ஹஸ்பண்டோ எல்லாரும் சேர்ந்துதான் இது ஒரு வீடு வாங்கியோ ஒரு கடை வாங்கியோ எங்க கையில காசு இருக்குது. நாங்க ஹாலிடே போறோமோ பிள்ளைகளை படிப்பிக்கிறோமோ எல்லாத்தையும் நாங்க ஓரளவுக்கு செய்து கொண்டிருக்கிறோம், எங்களால முடிஞ்ச அளவுக்கு மற்றவைக்கு செய்யறோமோன்னு சொல்லிட்டு. அப்ப எல்லாம் நாங்கள் ஒனஸ்டா இருந்து இதுன்றதுதான். ஒனஸ்டியா இந்த நாட்டுல சரியா மதிப்பு நம்ம எப்பவுமே. சோ அந்த அளவுக்கு செய்யுங்க. நர்சிங் உண்மையில அது வந்து ஒரு கடல் மாதிரி நிறைய நர்சஸ் இருக்கணும். நான் சொன்ன மாதிரி டிவியோ டயபெட்டிக் ஸ்பெஷலிஸ்டோ இல்லாட்டி இந்தியால ஐவில ஸ்பெஷலிஸ்டா வரையினா உங்களுக்கு எது இன்ட்ரெஸ்ட் நீங்கள் ஒன்றுக்குள்ள போய் செய்து கொண்டு போய்க்கு நீங்க ஒன்று என்ஜாய் பண்ண விரும்புவீங்க தொடர்ந்து. அப்போ ஓகே நான் இதுல ஸ்பெஷலிஸ்டா வரணும்னு சொல்லி சொன்னா நீங்க ஒண்ணு செய்ய தேவையில்லை, உங்களோட மேனேஜர் தான் கதைச்சா சரி. அதுக்கேற்ற மாதிரி உங்களை பார்த்த போட்டுப்பினோம். சோ பார்த்து எல்லா பக்கத்துலயும் போய்கொண்டு இருக்கோம். எந்த பாத்துல நீங்க போறீங்கன்றத நீங்க சூஸ் பண்ணி நீங்க போய்கொண்டே இருக்கலாம். உங்களை ஸ்டாப் பண்றதுக்கு எதுவுமே இல்லை. எல்லாருமே என்கரேஜ் பண்ணுவீனா, எல்லாருமே உங்களை சப்போர்ட் பண்ணி கொண்டிருப்பினா. அதை விட இப்ப அவ மினியோ இல்லாட்டி நானோ என்னவுமே நீங்க எங்களை போன் பண்ணி கேட்டாலோ என்ன இதுண்டாலோ கட்டாயம் கைட் பண்றதுக்கு நாங்க ரெடியா இருப்போம் எப்பவுமே. ஒரு எதுவும் கவர் பண்ணணுமா நிவேதா?
No, that's fine, Narayanaka. This is the Kanamaveka. I just wanted to get a view. Eppadi irukku system done. So okay. I just want everyone to know Narayanaka does son. Narayanaka vandu war la struggle பண்ணி refugee India வந்து UK க்கு தனியா ஹஸ்பண்ட் இல்ல தனியா வந்தவங்க. UK ல இருந்து லண்டனுக்கு சாரி இந்தியால இருந்து தனியா வந்து she did her 12th முடிச்சிட்டு இங்க வந்து படிச்சு she got her degree and then ஜாப் எடுத்து வேலை பண்ணி இப்ப அவங்களோட சன் வந்து 4 years தான் கேம்பிரிட்ஜ் யூனிவர்சிட்டியில படிச்சிட்டு இருக்கிறார். இட்ஸ் ஒன் ஆஃப் தி டாப் யூனிவர்சிட்டிஸ் இன் தி வேர்ல்ட். அண்ட் ஷீஸ் அண்ட் இங்க படிச்சது வந்து எந்த ஸ்கூல் நாராயணக்கா உங்க மகன்?
இப்ப யூனிவர்சிட்டி ஆஃப் வெஸ்ட் லண்டன் அம்மா சொல்றவன் வந்து தேம்ஸ் வேலின்னு சொல்றவன்.
ஓகே ஆல்ரைட் மாஸ்டர் யா
இதுட்டு வந்து நான் இது செய்த நான் டிகிரி செய்தது பக்ஸ்ல, டிஎன் கோர்ஸ் செய்தது பக்ஸ்ல. நீ அடுத்தது என்ன செய்யலாம்னு பார்த்து கொண்டிருக்கிறோம். அப்ப ஓரளவுக்கு நாங்க கம்ஃபர்டபுள் ஆயினோம்னா எங்கட பாட்டுக்கு மூவ் பண்ணுவேன். எங்கட மேனேஜர்ஸும் எங்களை புஷ் பண்ணுவேன் அடுத்த லெவலுக்கு போங்க போங்க போங்க. அது வந்து இந்த நாட்டுல நான் எப்பவுமே அப்ரிஷியேட் பண்ற ஒரு விஷயம் வந்து எந்த ஒரு விதத்துலயுமே உங்களை ஹோல்ட் அப் பண்ண மாட்டேன். ஹார்ட் ஒர்க்கும் ஒனஸ்ட் டைம் கேட்கல அவ்வளவுதான். அதாவது சொல்ற மாதிரி டாக்குமெண்டேஷன், உங்களோட டாக்குமெண்டேஷன் நீங்க என்னென்ன செய்யறீங்கன்னு செய்தோண்டு வரைக்கும் அதுவும் ஒரு இம்பார்ட்டன்ட் பார்ட் உங்களுக்கு அடுத்த இதுக்கு நீங்க கொண்டு போறதுக்கு. அந்த மேனேஜர்ஸ் வந்து அதை கேட்க தெரியுமா எவ்வளவு குவாலிட்டியா நீங்க ஒர்க் பண்றீங்கன்றது உங்களோட டாக்குமெண்டேஷன்ல தெரியும். நீங்கள் வந்து ஹேண்ட் ஓவர் பண்றதுல தெரியும். ஒரு நாளும் ஃபீல் பண்ணது ஆல்வேஸ் நீங்கள் வந்து சரௌண்டட் பை பீப்புள், அதர் ஹெல்த் ப்ரொஃபஷனல் நர்சஸோ டாக்டர்ஸோ பிசியோதெரபிஸ்டோ இல்லாட்டி ஒக்குபேஷனல் தெரபிஸ்டோ எல்லா விதமான இதுவும் உங்களுக்கு தெரிய வரும். ஒரு நர்சிங்க்கு நீங்க போகல இப்ப நான் ஒரு பேஷண்ட் விட்ட போறேன்னு சொல்லிச்சேன்னா நான் டக்குன்னு அசஸ் பண்ணி போட்டு சொல்லுவேன் ஓகே இந்த பேஷண்ட்டுக்கு ஒக்குபேஷனல் ஹெல்த்ல இருந்து இந்த இது தேவை, பிசியோட இருந்து இது தேவை சொல்லி சொன்னா அதுக்கேற்ற மாதிரி அவைய ரிஃபர் பண்ணி விடுவோம். நாங்க ரிஃபர் பண்ணி விட்டு அவ்வளவுதான், நாங்க அதுக்கு பிறகு ஒன்றும் செய்ய தேவையில்லை. அதை ஐடென்டிஃபை பண்ணி அந்த இடத்துக்கு ரிஃபர் பண்ணி விட்டா சரி. அதுவும் எங்களுக்கு தெரியலன்னு சொல்லி சொன்னா நாங்க திரும்ப வந்து எங்களை டீம் லீடர்கிட்டயோ மேனேஜர்கிட்டயோ போயிட்டா அவை எங்களை கைட் பண்ணுவிடும். சோ எதுக்குமே பயப்பட தேவையில்லை. தொடக்கத்துல கொஞ்சம் இதா இருந்தாலும் பயப்படாம நாங்கள் ஒனஸ்டா இருந்து கொண்டு ஹார்ட் ஒர்க் செய்து கொண்டு போய்கிட்டு இருந்தா தாராளமா இருந்துடலாம். அது இந்தியாவா இருந்தாலும் சரி, இந்தியா இருந்தாலும் சரி, நர்சிங்க நாங்க என்ஜாய் பண்ணி செய்தா உண்மையில அந்த பேஷன்ஸ் தேங்க்யூ சொல்றதை மீன் பண்ணி சொல்லிக்க அதை போல சந்தோஷம் ரெண்டுமே இல்லை.
Thank you so much, Narayini. Students, do you have any questions to add? There's one question here. OET exam one is it only for UK?
No, it is not. Australia, there's quite few other countries use OET.
Okay.
It started from Australia, actually. OET initially started from Australia. From there, we actually accepted from 2 years ago for you to UK.
Okay.
There's quite few other countries also use OET. I think New Zealand, I don't know all the countries, but definitely New Zealand or UK and Australia.
There's another question from Armugamana. Is clinical diagnostic parameters are similar in India and UK?
Somewhat similar, but there is a variation little bit. The way we look at the HB and all.
Yeah, slight variation in the.
You should know that, it's a variation, little bit, not the massive.
Yeah. Is there any other questions?
But if you look at like your blood pressure and everything is same, like temperature, blood pressure, pulse, that's all the, exactly same like India. But the hemodynamic analysis may be a little bit variations. Different ranges, yeah.
Mohan, live stream Nipatrana, you want to stop streaming?
Yeah, we can stop. Yeah.
Yeah.
Yeah, thank you so much.